I am an oncology specialty pharmacist here in Jacksonville, Florida. My pharmacy sits inside of a comprehensive cancer center, and we are really integrated into the healthcare team and have our small little pharmacy there where our patients can come in and sit down and are able to talk to me and my pharmacy team and really start that journey off.
I am into a year worth of ongoing chemo treatment. I was diagnosed with breast cancer. I was back in 07 or 08. It's been so long ago, I can't tell you exactly which. And then I had a 5-year reprieve, 5 years of doing real well, no signs of anything. Then we started seeing something happening in one of my lungs. So I went in for surgery, and they found that it had metastasized to my lung. Future CT scans showed it had gone into my liver and a place or two on my spine. Long story short, here I sit, almost 12 years into it.
I was diagnosed in 2015 with metastatic breast cancer. I continued to work all the way as a hospice nurse up until a couple of years ago. Having cancer, I try really hard not to let that define what I do. I'm very active in my community.
We're trying to have a child for close to 5 years. We experienced unexplained infertility, and we went through fertility treatments. They didn't work, and then we just resigned ourselves over to, you know what, Lord wants us to have a kid, we'll have a kid. If not, we're happy. And it was only a few months into that process that we found out that we were pregnant. And then a few weeks into my pregnancy, I started having itchy palms and itchy bottoms of my feet. That is a sign of intrahepatic cholestasis of pregnancy, ICP. It's a very rare lipid disorder in pregnancy. And so every 2 weeks, I was getting this blood work done. And it was showing some weird trends in my blood work, and my white blood cell counts, my hemoglobin was really low, red cells, all these things were just not making sense. The moment that the hematologist saw all these weird trends, his eyes widened. He says, I need to admit you right now for a bone marrow biopsy. That night, after the bone marrow biopsy, a doctor came into our room. My parents were getting ready to leave. It was just my husband and I, and my parents. And she could tell by the carefree atmosphere in the room that we had no idea what was going on. And so she said, I'm sorry to be the one to tell you, but you have leukemia.
I was diagnosed with non-Hodgkin's lymphoma when I was 30 years old. I was going from my late 20s into 30s. I didn't feel as well. When I went to the bathroom, I would bleed. Over the course of 8 months, this gastroenterologist did every test he could possibly think of that could explain why I was going through, bleeding every 2 weeks for 8 months. Around that 8-month mark, he said, listen, Derek, there's really nothing more that I can do for you. Before I send you on your way, I'd like to try one more thing, if you don't mind. Exploratory surgery. The likelihood of it being cancer for you is around 2%. I go, they lay me down on the table, and they put the mask on me, and I go under. And the next thing I knew was waking up in recovery. There were new doctors there that I didn't recognize. And the gastroenterologist steps up to my bedside and he says, Derek, we found a tumor in your intestines about the size of a grapefruit. We had it biopsied while you were under, and we have to tell you that you have non-Hodgkin's lymphoma.
Thank you for sharing. Tell me about your current regimen.
I go once a week for a 30-minute infusion, then I have a week off. And I usually have several low days where my energy level just isn't there, but I found that if I eat smaller, more frequent meals, that helps my energy level. And I have to make myself in those days get up and move around some. I don't do anything aggressive on those low days, but I do make myself get up and move. And that, I think, helps the restorative process.
I was about 3 months out from being declared in remission and not going through chemotherapy anymore, and I started having breathing issues. But this new doctor runs me through these tests, and he sits down by my bedside. It looks like one of the drugs in your chemo cocktail has damaged your heart. At this point, you are on the verge of needing a heart transplant. And for 7 years, I would go to bed at night wondering if I was going to be able to wake up the next day. And finally, 7 years into that, I went for a follow-up checkup with my cardiologist, and he says, Derek, we were hoping that your heart would get better. It's not. We have to put you on the heart transplant waiting list. And so I said, okay, let's do this. That night I went in for my transplant. I woke up the very next day and I was intubated and I had all these machines beeping and whirring and clicking around me. But the most powerful sound I heard was the powerful realization that at a certain point in my life, I could lay my head on a pillow and hear my own heartbeat. And I've done everything from that moment to try and make the most I can of this life, to be the best custodian I can of this person's legacy, this person who took the last day of their life, the worst day of their life, to save the life of a complete stranger. My job now is to try and earn the gift that they've given. And so I've taken good care of myself. I've become an athlete. I've become a triathlete. I've ridden my bicycle from Santa Monica, California to Avalon, New Jersey, and become the first person to survive cancer and a heart transplant to finish an Ironman triathlon.
I am blown away and inspired by all of your stories. We've heard from Derek as far as his experience with his care team and physicians and pharmacists alike. What, for your experience, what was it like with your care team?
So it's like a family.
God blessed me with a huge care team. And I had at the new center, the pharmacist there, oh my gosh. Who would have thought that I would have learned as much as I did about some medications, and not only the medications that were being given, but also how to pay for those medications. The special programs that are out there that they are aware of that help patients with medications, because I needed that when I, was unable to work as a nurse. I could not work at all. That went my income and my insurance.
I've been so fortunate to have such a fantastic team of healthcare professionals surrounding me. At every step of the way. Everything has been extraordinarily well laid out for me. I think one of the things that scared me coming out of cancer and transplant was just the fact that I was given literally a 3-ring binder of what I was supposed to do to take care of myself. And I was on 50 plus medications a day at extremely high dosages, having the alarm reminders on my phone, and then having the email reminders and the text reminders that I got from my pharmacy saying it's time to refill your prescription. Are you on target? And when people start not doing what they need to do for their medications, when people start cutting themselves off from the outside world and stop going out to dinner with their friends, or they stop getting outside and seeing the sun, they start to close off their world, and the world becomes what is immediately surrounding them.
I think that's a key piece of moving forward and ensuring the long-term survival of our patients, is having that mental wellness check-in, just as much as important as it is to have those adherence discussions.
The mental health, there are issues. That's something that nobody really wants to talk about. Have I gone to those dark places? Oh, most definitely. But I also realized that when I got to that place, that I needed somebody to talk to and sought out someone to talk to. And that's what I say to everybody. Mental health is important. Isolation is really horrible for us.
Do you ever feel that people treat you differently because you have cancer?
That was probably July of last year. I was in the grocery store struggling, and I was still real low energy, and I was kind of struggling to get through, and I guess a gentleman saw that, and by the time I was ready to check out, he presented me with a bouquet of flowers and touched me so much that, of course, I start bawling happy tears.
When I was walking around 9 months pregnant with a bald head, that was definitely a head turner for some people. They're looking at me like, they would say like, oh, wow, I love what you do with your hair. And so I constantly had to say, well, it wasn't by choice. Cancer took my hair, but thank you. So those are the funny glances that I would get, just people unsure if they should say something or not, because surely a pregnant woman couldn't, have cancer, right?
I talk to a lot of my patients about the moments when they start to lose their hair. Was it empowering, or was it tough for you?
As vain as it may sound, I get choked up now even talking about it. That was the most emotional part for me. Like through cancer, I had said, if I have to go through this, I don't want to look like I'm sick. However, it was really empowering the night that my husband and I shaved our heads. And I actually kind of dig the bald look. It wasn't so bad after all.
I just want to end our conversation. If each of you would like to maybe share a little piece of advice or maybe uplifting note that you would like to send off and share for all the other patients and caregivers that this will reach and might be impacted by.
Joy is not really based on your circumstances. Happiness is. Joy is an intrinsic thing, but God just restored my joy, and it doesn't matter what my circumstances are, living in joy.
She said that there's one thing that you can't ever take from anyone, and it's hope. And you mentioning joy, you're right, joy is just intrinsic, and hope is also, I think, right there along with joy, that you can't take that away from someone.
So just being able to provide that hope to others is really important for me. And telling my story is really important for that purpose as well. And so I think part of the mental health aspect that a lot of survivors take on is to become an advocate and to tell their story, because it also helps us in our healing process, but it also empowers somebody else and gives somebody else hope.